Hello everyone, Dr. Andrew, Dr. Sarah from Functional Wellness Center here in Scottsdale, Arizona. We specialize in something here called chiropractic biophysics, where we actually rebuild the structure of the spine. So when you do come into our office, we do a consultation, examination, and any necessary x-rays, and then we analyze those x-rays. And a common thing we see these days because of cell phones, people looking down on their cell phones, working on laptops, is the thoracic spine, which is the middle part of your back where all your ribs are, starts to actually collapse forward. So we use things called, this is one example of what we use in our office, they're called Denerals. There's two different types for your thoracic spine. One is a little less aggressive, we call this a regainer, and then this is actually your thoracic Deneral. So we sometimes start off a little bit easier on people depending on what they need, but these are done in our office and at home and help reform and remold the curvatures of your spine. So we're going to show you what it looks like and how we do it. So Dr. Sarah is going to put these under me, and I'm going to lay down and show you how we do it.
So the first one, this one, it doesn't have the bump that this one has, and we use this on anybody who's just really, really rigid and stiff, or maybe on the older population, or maybe somebody who has an increased curve but it's not severely increased, and we can use this for their spine. So what we do is it's just dependent on where the curvature is. So if there's too much curvature up in here, we're going to put it like this. If there's too much curvature down in here, we need to put it in here, we flip it over and put it there. Okay? And so, do you want to show laying down?
Sure, I'll lay down and we'll show you how it's done. It's got to be done on a hard surface.
And these are prescribed by us because we do a technique called CBP. We are allowed to prescribe these certain Denerals, and it's all just dependent on what your spine looks like. So you would have it, put it in the proper area where that curvature kind of curves too much, and then we'll have him lay his head down, and then he relaxes down. And so what it does is it takes your spine from this to this, okay, improving your posture and therefore improving your spine health and overall health as well. So now if you come on up, this is the one with the bump, and this is typically what we use on people normally, and in the beginning it can be a little tough, so we just work our patients up slowly on it. And then this is usually the one that patients say that it feels really good, like once they work up on it. They love laying on it at night or in the morning because it helps to open up their chest and really help to relax all the muscles, and they can breathe better, so they like it, especially after a day at work on the computer or something. So then we put it right there, if that was the area that he needed, and then he would lay down on there. And we will work our patients up to about 25 minutes at home on this. And then in the office, we'll do other tractions that we can't really show you right now, but we would do other tractions to help bring the posture back into its proper position. Taking pressure off the nerves and off the discs and improving your health.
So that's just a little example of what we do here in our office and stuff that you would do at home if this was if this was what your spine needed after we analyzed it. So any questions, let us know. Feel free to email us. Our email address is on our website, chiropractorscottsdale.com. And yeah, if you have any questions, let us know.
Thank you.
Thank you.